In this demonstration of Tekscan, scan and review, we're going to go over a slightly different bite than we normally teach. It's called a crunch and grind. The series of videos I have here were done by a local dentist in the Massachusetts area, and he, I would say, developed this process of crunch and grinding using Tekscan to help identify painful teeth. So when a patient comes in this case, patient was complaining about a forceful, painful contact on 2, and if we flip the arch to the lower, 31. When they took the standard closure multi-bite like we normally do and proceeded through the A to B area, there wasn't any clear demonstration of forcefulness, especially since the forces are pretty low during the closure here. The highest force during the A to B area was a yellow, green, and a slight orange, which at this point in the movie is somewhat acceptable. And so the doctor here took it to the next level and asked the patient to bite down on the sensor and reenact the movement that causes the pain. And so this is called a crunch and grind recording. There's a second recording here. And you can see the A to B area is very similar, low forces. But when we go to the C region where they began the movement of crunching and grinding, you can see what happens on tooth number 2 is a pretty high spike. And I'm just going to rewind and fast forward here incrementally, but you'll see the colors a lot higher. Earlier it was all green. And so here comes the first or second movement towards 2 during the grind, and it really gets a spike of high force. So as we watch this, it gives us an indication that it's the distal on number 2 towards the lingual side that is causing the pain. And so now that we're doing this specific movement, we get a better description of where the pain might be coming from. We can adjust that area, and in turn, the next scan during the grinding motion, you'll see, and you can see it here on number 2, that the forces are lower already. It's a light greenish color. And if we play it a little bit, there's your pull to the left, and then your pull to the right, and the forces stay significantly lower. Now, one thing to indicate with this movement, though there are higher forces in other places, we're really being specific to the complaint of the patient. And so when the doctor created this, it was really to focus in on a specific area that was of concern for the patient. And so this is a crunch and grind movement. Hopefully this helped you. If you need additional resources, feel free to contact your training team, or you can see our online videos at Tekscan.com. Thanks a lot.